shall we move on to stifles, so knees, and talk
Yeah.
about cruciate and the new things that are going on with that?
Absolutely. So cruciate ligament injuries in the dog, we call it a CCL, versus in a person, it's an ACL. And typically when we think of ACL tears in people, we're thinking of football players and basketball players, runners, skiers. There's a big traumatic event. Versus in the dog, it starts to degenerate or break down over time. So it's considered more of a disease process. And so it's going to be one of the most common orthopedic issues that we see. And we've gotten better at diagnosing these in the earlier stages of things rather than waiting until we just have a full blowout tear. And what I mean by that is really starting to pay particular attention to when a dog gets up, if they're stiff and they're sore, if they are sore after activities, or maybe they're at their water bowl and they're starting to lean and take a little bit of weight off of one of their back legs. We can use what's called arthroscopy, where we take a little camera and put it in the joint in a very minimally invasive way to see these tears when they start out very early. And I think that gives us the ability to do something surgically. And there's a lot of different surgical procedures out there to help stabilize the knee. And the whole goal is to try to slow down and minimize progression of arthritic changes, because in the case of tearing of the cruciate ligament, that allows instability to occur in the knee, which means that the cartilage is being rubbed atypically. And over time, that will result in osteoarthritis. So our goal there is to try to stabilize the knee, so that way we can minimize and slow down those changes. And I think if we can recognize it very early and intervene rather than waiting till later, then we're going to have a better long-term outcome.
Absolutely. And the next joint I want to talk about is elbows.
Yeah, elbows are still a really crummy joint. It's one of these, we've looked at a number of different things. We've looked at putting a little camera in the joint and just kind of cleaning up a little bit, removing little fragments. We've looked at cutting various portions of bone, whether it's the humerus or the upper arm bone, or we cut the ulna, one of the lower bones, to try to improve the fit. And, Professor Noel Fitzpatrick probably says it best, where it's really basically a poor fit. Think about the horse and the rider and having that good fit of the saddle. And if your saddle isn't fitting well, your bum's going to be sore. And it's the same way, we have based all of our decision-making on how do we improve this fit to make it better. The problem is no matter what we do, they're going to go on to develop pretty severe osteoarthritis. And the elbow is not a very forgiving joint. It doesn't respond well to something abnormal. And so we're still kind of holding out for that, thing that is going to significantly change the game. Unfortunately, elbow replacements tend to have quite a high complication rate associated with them. There's partial elbow replacements we can do. We've started really going towards a lot of various what are called intra-articular injections, so where we inject something into the joint, very similar to what they do in people, and sometimes that's something similar to cortisone, or we could go down this avenue of what's called biologics, where we talk about things like platelet-rich plasma, and we could even dabble in some stem cells there. At least in the US, there is a new product that's a radioisotope that actually will help minimize inflammation in the elbow for about 9 to 12 months. And then I believe in the UK or in Europe, you guys have just gotten the approval of a anti-nerve growth factor injection.
Which Librela, it's a hot topic.
Which I'm super excited about. Unfortunately, it's not approved in the United States yet. But many, many years ago, probably about 6-7 years ago, when this first came around, I was, involved with catching up on a lot of this, and I thought it was going to be a great product, and then it disappeared. And so I was super happy to see it come back, and hopefully if anybody's dog out there has received it yet, hopefully we'll be getting some great positive feedback on that. So I think that could be helpful.
We've had a number, actually, because we have our Holly's Army group with CAM, and a number of people have had their dogs have Librela, and I think the main concern has been stopping their dogs doing too much after it, because they suddenly feel so much better. But we haven't had, I'm presuming you're talking about cyanovetin when you talk about the radioisotope.
Yeah.
I'm not, I don't think we have that in the UK yet. Certainly I haven't seen it in practice, in first opinion practice, but we have had Librela in, so
Perfect.
that's exciting.